everyone. This is Smriti Mishra, and on behalf of Phygenics, I welcome you all on another session of Phygenic Conversation. And we mostly talk about the theme of wellness, employee well-being, corporate wellness, and all about well-being. With the onset of pandemic COVID-19, we have been working mostly from home. Working for long doesn't invite much body movement, and sitting prolonged could be detrimental to your health. Poor postures lead to strain, sensitivity to nerves, and also raises the risk of injuries. Still, you can maintain good health by improving body postures and learning some work ergonomics. It's time to reset your body alignment, and to understand it broadly, we have our guest today, Dr. Vishal Chaudhari. Dr. Vishal is a reputed orthopedic spine and hip surgeon practicing in Noble Hospital, Pune. He was previously associated with the esteemed hospitals of Mumbai. That I know you personally, Dr. Vishal, that you were associated with Nanavati Hospital, Cooper Hospital. So these are very reputed hospitals in Mumbai, and everybody respect that. And you were also associated with KEM Hospital in Mumbai only. Through his expertise, he has helped many patients to get back to active lifestyle. His practice and teachings have been helping people in getting relief from pain and regaining the lost mobility. He's also an avid researcher. Dr. Vishal devotes his time for advancement of science in the field of spine surgery. So we are so glad to have you, Doctor, today. And with this introduction, I welcome you on this session. And let's start with some question round. Are you ready?
Yeah. Hello everyone. Thank you. And thank you, Smriti, for inviting me on this Zoom webinar on the behalf of this Phygenics, and definitely on the important topic for the employees like work ergonomics, right?
Yes, it's a very required topic that we all should know and understand and to learn something, because majority of us are working from home and we are sitting for a prolonged time, and we actually do not care for our body alignment. Okay, so I'm sure you will help us to learn better, and we can start following your tips, your valuable tips. Okay. So let's start with the question now. My first question to you is, how much a correct sitting posture at work matters for good health?
Yeah, actually, we should understand what the posture actually is. The posture is nothing but a position or just the alignment of our body parts while engaged in some activity. So actually the position plays, or posture plays, a very crucial role in maintaining our health of the spine, neck, and as well as the overall body parts. And whenever we are especially engaged in working in sitting posture, the posture should be like a pivotal part of our working. So actually the faulty postures leads to impairment of our many of the joints, our bones, the ligaments and the muscles, and leading to the various health ailments. As we know, whenever the faulty posture is adapted, and if the same gesture is repeated every day, as many of the people are doing, like in working in sitting position, in that scenario, some muscles are tighten and some becomes very weak. And because of this imbalanced muscle activity, what happens, there is uneven or imbalanced compression of the joints, which actually leads to early degeneration or early impairment of the joint function, and leads to discomfort or paining in the joints. So really speaking, the overall bad sitting posture at work leads to many health disorders like chronic neck pain, chronic back pain, spondylitis. And as we know, our spine is nothing but made up of many small bones, and these bones have the mobility because of some cushioning, because of what we called as a disc, and it actually helps in shock absorption. So what happens, whenever the improper sitting postures are actually followed every day, there is excessive pressure on this disc, and which leads to early degeneration or sometimes the pushing back of the disc or these cushions and pressing on the nerves, what we call it as a sciatica like pains. So it is also one of the reasons for the imbalance or improper sitting postures. The another health elements, like if there is a continuous pressure on the wrist while working on a mouse or a cursor, the front front tissues of the wrist are continuously rubbed or they are continuously pressurized. So these tissues becomes hypertrophied or they becomes overswollen, overgrown, and because of that, there is a nerve compression at the wrist, what we call as a carpal tunnel. These kind of health elements
Yes.
actually develops over a period of time because of improper sitting posture.
Exactly, doctor, you have really enlightened, and I'm not sure majority of us will understand the literature part, but the whole idea what doctor is trying to say is your body align. You must understand your body alignment, and if I can very easily explain it, you should take a frequent breaks in between. And if you are putting pressure on your on the table or whatever, if you are using a mouse or even you are using your fingers for a laptop or in place of your cursor, you should frequently take breaks, because to give rest to your fingers are also very important. So that's what, if I can make it in a very simpler way, what doctor is trying to explain and suggest you to take frequent breaks and relax your muscles, relax your fingers, do some finger stretching, and then you can start fresh work. Okay, doctor, so moving to the next question. How work from home employees can best manage their spine health? Because they sit for long and stick to a same position wherever they are. So how can they improve it?
Yeah, actually, as we know, the work from home is really a new concept nowadays, which actually many people are trying to adapt.
Yeah.
And actually, it's really a new challenge to adapt and make some changes and really make our workstation like we are making our workstation, like our dinings, our lounges, our kitchen tables. So we are trying to adapt and making everything like our workstations. But what happens really is, if you try to work on a bed or on a slouching on a sofa, you may feel comfortable for a few hours or even for a few days, but definitely after a period of time, you are going to develop some soreness of your upper back muscles, shoulder, as well as neck muscles. So definitely the best way to reduce these health elements is to make few changes at your workspace.
Okay.
Or at your work from home space. And these few changes are really crucial just to maintain your overall health or the overall health of your bones and joints. So adapting a new ergonomic chair with a proper height, with a adjustable desk or a table is a mandatory, though it may add some investment, but I think it's really a good value for money, because prolonged sitting and slouching on the sofa are really the two important factors which are actually are the culprits for chronic back and neck pains. So the proper way of sitting should be adapted at home whenever you are working from home. So what is this proper way of sitting? So that proper way of sitting should be, you should sit straight, upright, making your whole back upright straight, supporting your whole back, especially your low back has to be supported whenever you are trying to sit and work for a long time. And at the same time, you should keep your other joints as well as bones, muscles relaxed. The second thing, exercise and stretching of at the regular interval, especially at the home, is a key to prevent the protect your spine. Is the key to protect your spine. So what everyone has to follow is, after continuous work for, you can say, 2 hours or probably 3 hours, you need to get up, just try to walk around for 10-15 minutes, at least take a break of 20 minutes. And in that 20 minutes, either you can take a simple walk, can do some stretching of your legs, even you can do some stretching of your neck and upper back and low back muscles, so that the muscles which are actually sored enough in working in sitting position should get relaxed and should be stretched at a regular frequent intervals to prevent the chronic health elements. Plus, along with that, what you can do is you can simply, at some time, you can simply just close your eyes, just take calm, or just try to meditate, just to relax your brain from the stress, or even the eyes from your excessive strain while working on the laptops and the PCs. Plus, the engaging regularly in a low aerobic activities, even at home, regularly in the morning, definitely going to increase the blood supply to your many organs or tissues of your body, and going to keep it healthy. So I think regular stretching and working exercises, as well as aerobic exercises daily regularly, are the key elements to prevent the health elements.
Absolutely. You have made very such useful points that actually my next question will, it's exactly what I was about to ask, and you had few things you have already explained here. Just to remind you all, and whoever will listen to this conversation, that doctor suggests you to have frequent breaks, and this you can consider as a healthy breaks, and avoid forward bending, like you are all the time you are with your laptop or your PC, like you're forward bending like this you do. So avoid that, because this is what the doctor says, conveys, and requests you to keep your posture aligned with your body, and don't give much pressure forward. It should, doctor, you're saying to strengthen your back, right? To
Right.
give weight to your back, so that it will, give a strength to your posture, and then you can have a healthy body alignment. So it's a very
Right.
useful, and wherever you are, if you're working and listening to this conversation, start practicing it, because just listening to it won't help. Start practicing it. Okay, doctor. So moving to the next question. Uh, how digital employees of present times can best lower the risk of back pain and spine related disorder? I think you have already made your point, but very quickly I would like
Right,
to
definitely.
again.
Because as we know that today, what we can say is today world is digitalized completely. So
Yes.
gone are the days when the people are used to move for their work, but right now because of digitalization, everyone is stuck at one place and have to work for long time at the same place, sitting at one place. So what I mean to say, there is definitely few ergonomic tips for the digital employees I can mention. So setting in that ergonomic tips, the first thing is setting up of your screen. So your screen should be not to be high, not to be low. It should be parallel to your eye level or parallel to your eyesight. And at the same time, the brightness of the screen should not be that much too high. Otherwise, it may excessively strain your eyes. The second thing, you should adapt, or you should sit properly on a ergonomic chair. And how that ergonomic chair sitting should be, like chair with a backrest is mandatory. Your head, neck, and shoulders should be properly aligned and kept, relaxed. Your arms should be perpendicular to the floor. And as I mentioned earlier also, your wrist needs to be properly supported either with a soft pads or soft cushioning for the usage on the mouse or the cursors. You should sit straight upright, supporting your whole back or low back. Your chair should be have properly cushioned so that your posterior thigh muscles or even the buttock muscles should not be sore for after a long period of sitting.
Okay, can I
The chair
interrupt you,
should,
doctor?
yeah,
If someone is using a dining table as their new workstation, and on the table they are putting the laptop, and they are using the chair as a work chair. So for cushioning thing to support the back, should we use some soft pillows, or some any kind of support? What would you suggest? How they can?
definitely, a sort of soft pillows can be used, but what happens many times is the dining chair is not that much of proper width or
Exactly. Yes,
yeah,
the
length.
bit is
So
not that.
if you try to keep a pillow behind you just to support your back, you are pushed forwards. So that ultimately leads to another health issues. But what I will definitely suggest is you should take a proper, either narrow size or narrow size or low heighted pillow, but that should be kept vertical, supporting your whole back. And you should not try to slouch on your chair. Rather
Okay.
than slouching,
Yes.
you need to
Very important point.
Okay, and straight. Yeah. Along with that, what I mean to mention is your keyboard tray should be also be adjustable, and there should be ample space between the thighs and your keyboard tray. Otherwise, there is a lot of discomfort while working for long hours. And whenever you are trying to work in sitting position, your desk, the space under your desk should be clear. Then and then only you are trying to stretch your legs in between, if possible. So these are sort of some things the employee should understand and keep in mind while working in a sitting
It's
position for a long
very,
time.
very relevant and very important points you have mentioned, Doctor. But I also, as an employee, you can say, as a worker, I try my best to, align my body movement properly. But many of the times I realize that, the finger stretching point that you mentioned, that thing, and to support the back, these things are it looks very simple, but we tend to forget. Okay, we'll do it later. But few of the tips that you have shared with us is very, very valuable, and I request you all to please follow this, because this is the platform where such experts are coming and sharing their views. So do follow, and yes, you can also connect with us, with me, or with Doctor anytime for your concern. But these are the tips you should follow that he had just shared. You share with your friends, with your families, with your loved ones, whoever you are, because good things must be shared. So do share these things. Okay, Doctor. So moving to the next question. What is the best practice that one can follow who is recovering from spine related injury? Because in present times, many of us might have gone through some surgeries and all, or doctor has suggested to take some rest, and they are not really willing to visit to doctor now, or because the situation is that way. So unless it is not very urgent, you should avoid going to clinics and all, and be at home, take care of your health. So for those patients or for those person, what would you suggest?
Yeah, actually. So spine related injury, I mean to mention about, there are two kinds of injury, like acute injuries and chronic injuries. In acute injuries means they have recently occurred, and in those injuries the pain is actually high. And why these acute injuries occur? Whenever we tries to do heavy exercises, try to lift up in ekdam sudden standing and bending position, so our muscles get relatively sprain enough strongly, and because of these acute injuries the pain is really very high. So what, whenever we have the acute high painful injury, so in that case we need to give rest to our spine. So rest means we should not sit for a long time, we should avoid bending in a standing position. So in that case, it is probably required to take a rest from your work pattern, like working from sitting pattern. And if it is not possible at all, then at least you can take a rest for few hours and few hours working. But even if you have to work in a standing position rather than sitting position, because sitting actually worsens your pain many times. And the second thing, what you can do is you can simply apply ice packs in between just to
Yes,
relieve
yes.
from the spasm as well as the pain. The third thing I want to mention is many people don't know whether to go ahead with the exercises after the acute injury or don't go with the exercises. But I mean to say, if anyone is doing the exercises prior to the injury, I will definitely going to suggest after acute injury, you should stop all the exercises, because the pain is relatively high. You need to give rest to your spine. Once you can control your pain, then and then only you can go ahead with your normal routine exercises program gradually. Depending on which exercises you can tolerate better way, you should go ahead with first. And once your pain goes down, you can progressively progress your exercises pattern. The same thing doesn't apply for the chronic injuries. The chronic injuries, the pain is generally mild and it occurs over a period of time. But the main etiological factor for the chronic pain is generally the faulty posture or the bad sitting posture. So in that scenario, there is no need of complete rest or no need of giving the complete rest to the spine. So you can work, but definitely there is a requirement of modifying your sitting postures. because that is the main culprit for causing your chronic back pain. So you should modify your sitting posture. You should try to support your low back area. You should try to get a proper cushioning support to your back. And again, I will suggest, you can, in chronic injuries, you can go ahead with a little bit mild exercises initially, but eventually, even after doing so many things, if your pain doesn't relieve after a week or for 5 days per se, you have to consult someone to just what definitely has occurred to your back and all.
Okay. So again, it's a very, valid points that you have raised, because that is the condition where people is so confused what to do, start with the physio or not, and sometimes they take suggestions from non-clinical person, and they are in the state of confusion what to do, what to not. So I'm sure whoever listening is will give attention to what doctor has said, that first thing in acute condition you can start with exercises but you should wait to heal it first. And if you're suffering from some chronic disorder or some chronic essence, then you first listen to your doctor, your treating doctor, or whoever your clinical practitioner associated with. Then only, do not decide at your own. Do not ask your friend. Do not ask someone who is not at all related to this medical field, please. Okay. Okay, doctor. Thank you so much. I mean, the way you are explaining to us, it's so interesting to understand, and it's so learning. It's a great learning to all of us. Thank you. Okay, so my last question would be about the strength and endurance of the back. That's all we have been talking about. So tell me, the strength and endurance of the back and abdominal muscles have been shown to related to the development of back pain. How much physical fitness is important in this context?
Yeah, definitely. So these back and abdominal muscles collectively, what we call is as a core muscles of our body. So why core muscles? Because these actually support our spine as well as abdominal organs. So whenever we are sitting, our main weight is exerted on our spine. So in that scenario, these core muscles play a crucial role supporting everything like abdominal organs as well as spine. So if our core muscles are not strong enough or are weak or tighten at one place, what happens? They are not going to support the spine in maintaining or in bearing your body weight whenever you are curvatures. And because of that, there is definitely a chronic back or neck pain along with degeneration of the spine occurs very early. So definitely what I want to focus or enlighten some points like strengthening as well as stretching of these core muscles are mandatory. And strengthening should be focused on these back spine muscles, upper back muscles, neck muscles, along with these abdominal muscles. Regular stretching in the form of yoga is definitely going to support and it has to be included in your fitness regime if you are not doing that. So stretching in the form of yoga, along with that, the many things you can add like pranayama or the regular breathing exercises which actually keeps your chest expansive, along with keeps your chest and upper back muscles stretch and strong. So that is going to definitely relieve or definitely going to prevent many upper back issues also. Meditation is definitely helping to relieve the stress on our mind as well as relieve the strain on our eyes in many ways. So meditation, yoga has to be included in our regular fitness regime.
Great. So to sum it up, doctor is advising us to include some breathing exercises, some yoga postures that you have mentioned, pranayam, and one more, what you have mentioned apart from pranayam.
Meditation.
Okay, meditation, breathing exercises. So these are the things, and we can easily do it. It just we need to devote some time for ourselves, for our own well-being. So this is definitely going to work. And since we all are working from home, sitting for extended hours, prolonged period of time, so we can easily take out sometime, I mean 15 to 20 minutes, 5 times in a week, we can easily devote. And this is for ourselves, so we can do. So doctor, this was very interesting round, and I find it very interesting, and I'm sure everyone, whoever will listen later to it, so they will find it very valuable in fact. And with this question round, now I'm finishing it and moving to the next round. This is a straight right question where you have to answer it in yes, no, or can't say. You do not have to explain or justify the answer, just you have to say your views. Either you agree or not. So
Okay.
just yes, no, or can't say. And then we'll move to some rapid fire round, okay? Where I will give you some term, then you have to just say whatever it hits your mind, okay? So we will start with straight right
Okay.
questions now. So I have a few straight right questions for you. Back pain is one of the most important reason for missed work. What do you think?
Yes.
Maintaining
Yes.
a healthy, okay, maintaining a healthy diet and maintaining a healthy weight is prime important to strengthen our spine.
Yes. Definitely.
Okay, posture correction is not required. Doing exercises in between is okay.
No.
So that's required actually. Heels of shoes
That's
and fancy sleepers has no correlation with the health. What do you think?
No. Definitely, they have correlation.
Okay, so all of us, many of us who are using the high heels and all, so they should take care of it. Okay, to check on work-related musculoskeletal disorders, work ergonomics should be given more priority. What do you think?
Yes.
Definitely. Okay, so moving to the rapid fire round now. Just you need to pick any one thing that I am giving some terms to you, or anything, whatever you like, good, or you think it should be. You need to pick anyone. Physical wellness or digital wellness.
Physical wellness.
Okay. Work posture or comfort place to work.
Work posture.
So you need to take care of work posture, not your comfort.
Right.
Expert session or self-made practice.
Self-made practice.
Great. Cushioning chair or ergonomic chair.
Ergonomic chair.
Lifestyle modification or drugs dependency.
Lifestyle modification, obviously.
Great. Okay. Now say what hits your mind first. Health.
Health is a state of art, disease-free or injury-free. Health is wealth, you can say.
Great. Health is best. Posture correction.
Yeah, proper posture actually keeps your spine healthy.
Great. Injury.
Injury can be avoided by doing regular exercises, regular workouts.
Great. Ergonomics.
Ergonomics is like science followed at workplace, or many disciplines at the workplace to optimize your health.
Great. Workstation.
Workstation, the proper ergonomics or the proper sitting posture should be followed at workstation.
Great. So with this, we will end the session for today. And I'm so sure that this is, going to be help many of us, including me, because I have learned very valuable points from your conversation. And I'm so sure that many of us who are actually work from home employees, they will get benefit out of it. So with this, I would like to end the session with you and everyone who has participated. And thank you so much, Mr. Subhash, Ms. Amita, Ms. Anna Patil, and Ms.